Hey, what's going on, guys? Ben here, and today we're talking about iliotibial band syndrome. Now, this is the second most common knee injury, and the name kind of explains what's going on here. It's an IT band issue. The biggest difference between this and patellar tendonitis, for example, is this pain is located on the outside of your knee. So you can see this picture to the left, to this diagram. You can see the IT band syndrome is on the lateral outside portion of your knee, and that's kind of where your IT band inserts into. So it makes sense why that's where the pain would be felt. The pain is typically most intense at 30 degrees of knee flexion, and you may feel stinging pain when the foot strikes the ground. Now, what is it caused by? Well, you can see this picture on the right. The IT band is a very, very long tissue, right? Very long band of tendons and tissues, and it originates from your hip and goes all the way down to the lateral condyle of your patella of your femur. So it goes all the way down to your kneecap, your patella, on the outside portion. And what happens is your IT band gets swollen and irritated due to overuse, and which can cause either compression, so it's pushing on the patella, or friction. It's rubbing against the patella. And when I say patella, I mean your lateral condyle of your femur, but right on the outside of your kneecap, right? It's applying pressure or friction right onto your knee. So some interesting things are that 12% of runners will get IT band syndrome. 20% of US Marines can experience IT band syndrome during training. And what happens is if your glute medius, your hip abductor, is not firing properly, other muscles need to work harder, which is what we'll get into shortly of how to solve IT band syndrome. Now, one study also found that getting better shoes actually helps solve IT band syndrome. Now, it may not be as easy as that for many people, but if you do have worn out running shoes and you have IT band syndrome, then getting better shoes may help with that. You can see in this picture here kind of where the origin insertion, where how big this IT band is. It goes all the way from your hips to your knees. So how do we fix it? Well, what they found is that runners that had IT band syndrome had weaker hip abduction in the affected leg. So if you do have IT band syndrome, you have lateral knee pain, you may have weaker glutes in the leg that hurts. One study where they took 24 runners, they had 10 men and 14 women with IT band syndrome, completed a 6-week rehabilitation program, and 91.7% of the athletes were able to return to running at the end of the program. Another study found that patients that stretched their IT band 3 times per day and strengthened their hip abductors were also able to solve their knee pain as well. So this is definitely something that you can work on training and fixing. One thing I want to talk about though as well that's very important, especially if you're a runner, is they found that runners with IT band syndrome had more knee internal rotation when running. Now, where else do we see this with excessive knee internal rotation? Well, another example is squats, right? If you're doing a barbell squat and your knees cave inwards, the typical diagnosis is to strengthen your glutes. So you can see a trend here that when your knees rotate inwards, there's typically you're going to want to do is strengthen your glutes. What they did find though is that resistance training, it can alter your hip mechanics and squats, so it can help fix your squatting issues, but not with running. So if you're a runner that's strengthening your glutes and you still have knee pain, then you definitely want to talk to some sort of coach and record yourself running and make sure and see if your mechanics are correct, if they're optimal. Because doing these exercises may not solve your running related issues, and your running related issues may also be making your knee pain worse as well. So you definitely want to work on strengthening your hip abductors, but also focus on proper running form. Now let's get into some of the exercises I recommend and how to actually solve this problem. So phase one is to reduce the amount that you're running, incorporate uphill treadmill walking, and strengthen your hip abductors. So some exercises you can do are things like glute bridges, lying leg raises, cable hip abduction, band walks. Make sure you focus on strengthening these hip abductors. Any sort of abduction work where your leg is getting pulled away from your body is going to be beneficial to fixing this pain. Once you've done this for a period of time, you can move to phase two. Now, phase two, you're going to incorporate heavy, slow resistance training. Now, I would always encourage you to keep training your hip abductors, training your glutes, of course, but incorporate some more weighted exercises. And I would focus on like a 3-1-3 tempo would be a great way to start. So if you're doing a split squat or a barbell squat or any sort of leg exercise, to do 3-1-3 where you do 3 seconds on the way down with a squat, for instance, hold for 1 second, and then 3 seconds on the way up. So focus on control of the weights as well as focusing on slow resistance training. So throw in some weights, slow progression. You don't want to just jump into some heavy weights right away, but do a slow progression down, hold, and raise up slow as well. So focusing on that control and strengthening those muscles. After this, we'll enter into phase 3, where we incorporate plyometrics into our workout routine. Keep up with the uphill treadmill walking as well as the heavy, slow resistance training, but incorporate some plyometrics to further challenge yourself. Now, with plyometrics, you want to take baby steps, focus on what feels comfortable for you and your pain tolerance. If you're doing some plyometrics and you notice that your pain jumps from a 3 to a 7, then maybe you dial back your training. But focus on learning control over your body, especially in explosive plyometric matters. Finally, we'll get back into running, where we focus on gait retraining. With this phase, you can drop the plyometrics, keep up with heavy, slow resistance training, keep training on your hip abductors, but focus on relearning how to run. Now, this may feel weird since you've been running the same way for your entire life, but watch videos online, work with a running coach, and retrain yourself that you run correctly and optimally. And over time, you should be able to fix your pain and you'll be back to squatting and running pain-free. Good luck.